My name is Michelle Sharpe, and I'm the professional practice lead for rec therapy in Central Zone for Alberta Health Services. And I only have 5 minutes, so I'm really going to try and jam pack everything into 5 minutes. The technology pitch that I'm presenting today is going to attempt to incorporate a number of different tasks and asks that will enhance the communication and connection between families, facility staff, and residents in congregate care settings. For those individuals with loved ones in long-term care and supportive living, I'm hoping to show that with the use of the technology or platform will enhance connection and communication between loved ones, but also keep family members and caregivers informed, including possibly direct links to important provincial updates and facility updates, access to education, support, and a resource library, as well as location for links for calendars and Zoom meetings and programming, recreation programming, as well as being able to independently schedule visits with your loved ones. Next slide, please. So these are a few of the problems, but they're not necessarily problems. They're a few of the barriers in which the technology or platform will resolve or continue to enhance. So that includes family members unable to connect with loved ones, like Carla had talked about and discussed, the limited communication and facility specific updates. So a few of our guest speakers had talked about this earlier, about being connected and more connected to site specific information, like for example, outbreak status or requirements for outdoor visits, changes in service provisions or visitor guidelines. Also a problem with being able to support and educate and have like a resource library available for those loved ones or caregivers or those family members outside of the home, so that they could have access to information about how to use Zoom, or educating archived webinars as to how to enhance your visit with a loved one who has dementia that is now not able to visit. Also looking at the schedule assist and calendars for the designated central visitors, so that if there's an online option, these social virtual visits as well as outdoor visits and requests for volunteer requests for virtual connection could also be scheduled from the end user. Next slide, please. So I'm going to focus a little bit more on just the recreation programming part of it. So due to COVID, restrictions included no visitors or volunteers coming into the facility. Group sizes were limited and the residents and were socially isolated in the rooms with limited face-to-face social and recreation and quality of life programs. Some sites were also eating their meals in their rooms, so very limited social connection with the residents. Currently, in some of our facilities in Central Zone, the recreation therapists have been creatively combating COVID using programs via Zoom, where the residents in the rooms can use their smartphone or a landline or join via video, and they can visit and talk to their co-residents that are doing the recreation programs on site, so that they can still access those programs via Zoom from their room, maintaining that social connection and programming. Residents have also been accessing Zoom programs such as entertainment, music, museum tours, and things like that from their rooms. There's other provincial programs that have been going on, but if it was a schedule was available with the Zoom link, the family member could actually join their loved one in some of these programs that are happening as well to maintain that social connection. So other examples that we've been trialing here at some of our sites is doing the resident and family council meetings via Zoom. So in particular, there is one site that trialed it 3 years. For the past 3 years, for the resident and family council meetings, there was no actual family members coming into the meetings, not due to COVID and restrictions, but due to distance. So recently when they hosted the Zoom meeting, 20 family members showed up from 5 provinces across Canada, and they were more than happy to have the opportunity to be involved in their loved one's care. So if this technology, if we had a hub or a platform where the Zoom meetings were located and the schedules, then the town hall meetings or information sessions could be joined from family members from afar. Next slide, please. So the requirements for this technology hub would be to look at a user-friendly platform that family could easily access, like a one-stop shop. The other requirement would be that there would be multiple organizers that could keep the site up to date, whether it's site-specific information or provincial programming communication updates or site-specific communication updates, a resource library, as well as a scheduling option so that loved ones could schedule their visits, as well as accessing virtual programming. Next slide, please. So current state right now is that, like we had mentioned before, Carla had said that the schedules, organizing and facilitating are supported by the on-site staff. So that's the virtual visits, resident family council meetings, outdoor visits, everything, the day-to-day care is all being provided by the on-site staff. So the potential for this platform is that if these links and available services, supports, and scheduling were found on this platform, then family members would be able to book some of those services independently and have access to global programming and information and connection. So the impact would be that it would optimize our resources. It would be located in one location. Families would be more involved, informed, and connected, and it would improve day-to-day interactions and quality of life for the residents and the family members, and enhance communication, connection, and socialization. Now, these are some of the things that we're talking about COVID, but we've all talked about these restrictions have been put in place because family members can't come in. But we all know that a lot of the loved ones in long-term care and supportive living have family members or supportive caregivers that live in far ways away in distances. So having this technology and options available would be great to continue, not just during COVID, but from now on. Next slide, please.